Therapy while tripping balls? Well, now my mind is blown. Psychedelic assisted therapy, P.A.T, involves the use of psychedelic substances such as psilocybin, MDMA, LSD or ketamine in conjunction with psychotherapy to treat mental health conditions like depression, post-traumatic stress disorder, PTSD, anxiety, addiction and end-of-life distress. The therapy typically includes preparation sessions, a dosing session in a controlled environment with a trained professional, and integration sessions to process the experience. What comes next is an overview of its legal status and where it is practiced, based on available information up to June 2025. An overview of psychedelic assisted therapy. What's the therapeutic potential? Research shows psychedelics can enhance neuroplasticity, promote emotional healing, and facilitate profound psychological insights. Clinical trials have demonstrated strong evidence for treating conditions like PTSD, depression, and addiction, with substances like MDMA and psilocybin showing significant effect sizes compared to traditional treatments. For example, a meta-analysis of 9 placebo-controlled trials found a very large effect size for psychedelic-assisted therapy. The mechanism. Psychedelics interact with serotonin receptors, inducing altered states of consciousness that can lead to ego dissolution, helping patients confront suppressed emotions or traumas. Now, what's the structure? P.A.T typically involves preparation, building a therapeutic relationship and setting intentions, then dosing, administering the substance under supervision, and then integration, processing insights post-session. Now, there are ethical and legal considerations. Most psychedelics are classified as Schedule I substances in many countries, meaning they are illegal outside specific contexts like clinical trials or religious exemptions. Therapists offering P.A.T often operate in a legal grey area or use harm reduction approaches to provide support without direct involvement in illegal activities. Legal status and the practice locations. The legality of psychedelic-assisted therapy varies globally, with some regions legalizing or decriminalizing specific substances for therapeutic use, while others restrict access to clinical trials or underground practices. What follows is a breakdown of where psychedelic-assisted therapy is currently legal or practiced as of June 2025. The United States. At the federal level, most psychedelics, psilocybin, MDMA, LSD and DMT are Schedule I substances under the Controlled Substances Act, with no accepted medical use and high potential for abuse. Ketamine, however, a Schedule III substance, is the only psychedelic-like drug legally available for off-label therapeutic use. P.A.T is otherwise restricted to clinical trials. State-level legalization. Oregon, the first US state to legalize psilocybin for therapeutic use via Measure 109 in 2020. Psilocybin services are available at licensed service centers with trained facilitators, not for home use. As of 2025, the industry faces challenges, with some clinics struggling financially. Colorado legalized psilocybin for therapeutic use following Oregon's model. Decriminalization measures also allow personal use without prosecution in some contexts. Other states. California, New Jersey and Connecticut have introduced bills to legalize psilocybin for medical or recreational use, but these are not yet fully implemented. Cities like Denver, Oakland, Ann Arbor and Washington DC have decriminalized psilocybin, reducing penalties but not fully legalizing therapeutic use. Clinical trials. P.A.T is primarily available through research studies at institutions like Johns Hopkins, Usona Institute and the Multidisciplinary Association for Psychedelic Studies, or MAPS. These trials focus on psilocybin, MDMA and LSD for conditions like PTSD, depression and addiction. Access is limited to eligible participants. Ketamine clinics. Ketamine-assisted psychotherapy is widely available across the US, as ketamine is legal for medical use. Clinics like Ember Health and Pacific Neuroscience Institute's TRIP program offer ketamine for depression, anxiety, and PTSD. Underground practices. Some therapists provide underground P.A.T with illegal psychedelics, often focusing on integration support to avoid legal risks. This is common but carries legal and ethical challenges. What about Canada? The legal framework. Canada reversed an 8-year ban on medical exemptions for psychedelics in January 2022, allowing limited access to psilocybin and MDMA through the Special Access Program for therapeutic purposes. Exemptions for personal use of psilocybin were granted in 2020. Alberta, in Canada. In 2023, Alberta became the first province to regulate psychedelic therapies, LSD, ketamine, mescaline, psilocybin, MDMA, for mental health treatment effective January 2023. The practice. P.A.T is available through clinical trials and limited medical exemptions. Training programs for providers are emerging, emphasizing ethical standards and patient safety. What about Australia? The legal status. Australia became the first country to legalize MDMA-assisted therapy for PTSD and psilocybin for treatment-resistant depression, effective July 1, 2023. These are classified as Schedule 8 drugs, requiring psychiatrists to be authorized prescribers under the Therapeutic Goods Administration with strict training and assessment protocols. What about the practice? Authorized psychiatrists can prescribe these substances in controlled settings. Concerns exist about the rushed legalization and limited hospital system participation. What about other countries? The Netherlands. Now, psilocybin truffles, not mushrooms, are legal, and retreats offering therapeutic experiences, often catering to international clients. These operate in a legal grey area. Jamaica. Psilocybin is legal and retreat centers provide guided psychedelic experiences, attracting those seeking legal therapeutic options. South America. Ayahuasca containing DMT is legal in countries like Brazil and Peru for religious and spiritual practices, often integrated into therapeutic retreats. Switzerland. Limited access to psychedelic therapy is available through clinical programs, such as those offered by the Alps Foundation. Religious exemptions. In the US, some churches have legal exemptions to use psychedelics like ayahuasca for religious purposes, though access may require cultural or spiritual alignment, which can limit broader therapeutic use. Challenges and considerations. Legal risks. In regions where psychedelics are illegal, therapists offering P.A.T face potential legal consequences. Harm reduction and integration therapy are legal alternatives where therapists support clients without administering substances. Ethical concerns. Issues like patient vulnerability during altered states, informed consent, and equitable access remain significant. Research often lacks diversity, limiting generalizability. Research gaps. Many studies are preliminary with small sample sizes, 10 to 50 participants, and controlled conditions. Long-term safety, mechanisms of action, and optimal protocols are still under investigation. FDA status. In 2024, an FDA advisory panel voted against approving MDMA-assisted therapy for PTSD, 9-2 on efficacy and 10-1 on risk-benefit, raising concerns about research credibility and safety. Federal approval for MDMA or psilocybin is estimated between 2025 to 2028. Where to access P.A.T clinical trials? Search for trials on clinicaltrials.gov or through organizations like MAPS, Johns Hopkins, or Usona Institute. Ketamine clinics, which are available across the US, particularly in states like California, for example, the Pacific Neuroscience Institute, and in Colorado. Legal psilocybin centers. Oregon and Colorado offer licensed psilocybin services. Oregon's program, overseen by the Oregon Health Authority, requires trained facilitators. There are international retreats. Jamaica, the Netherlands, and South American countries like Brazil and Peru offer legal psychedelic experiences, often combining therapy with spiritual practices. Integration support. Organisations like Psychedelic Passage provide legal coaching and integration services for those using psychedelics independently. Recommendations for seeking psychedelic-assisted therapy. Verify credentials. Ensure therapists have specialised training in P.A.T, such as through programs approved by the Oregon Health Authority or MAPS. Safety first. Choose providers adhering to ethical guidelines, ensuring a safe environment and proper screening for contraindications, for example psychosis or cardiovascular issues. Explore legal options. Ketamine clinics or clinical trials are the safest legal routes in most regions. International retreats are an option but require vetting for quality and safety. Stay informed. Monitor legislative changes as states like California may soon expand access. Check resources like psychedelic.support or MAPS for updates. So there you go, there's a whole lot of information there all about psychedelic assisted therapy. I hope you found it interesting, and remember, in the UK at the moment, psychedelic assisted therapy is currently illegal. Just to let you know. And I'll see you on the next one. Good night.